A popular cosmetic medical procedure that erases wrinkles is getting a thumbs up from the government.
Botox was FDA approved in 1989 for use in neurology and use in ophthalmology. And as a physician, we have the ability to use what we call an off-label use, where we take something that is FDA approved and we use it for another use that we believe is safe and effective. And it had been used in Europe in the early 80s. So I had trained in Europe, and I also trained with somebody in British Columbia that did use this technique. First, we're going to clean the area with a little bit of alcohol.
And does she have to be sitting straight up when you do this?
Well, she can be leaning slightly back. One of the important things is that we don't want the patient to lie flat, because if you lie flat, you can affect the Botox. So we don't want the Botox to move to other muscles of the face. So we instruct our patients to stay straight up for about 4 hours. We don't want them lying down. Now, there are many misconceptions about Botox. Some people think you can't fly, or you can't lean forward, or you can't try on shoes, but that's not really true. You just can't lie totally flat. So we tell our patients, don't plan to have your hair washed or have a massage right after the procedure. Just wait 4 hours till the Botox sets in the muscle.
All right, we'll let you start the process here.
So what I'm doing now is I'm starting to the injections, and she'll feel a tiny pinprick. And we actually do a series of injections. The Botox is a purified protein.
So it's bleeding a little.
A little bit. There's tiny oozing.
I had to tell you, that looks like it's painful to me. Doesn't hurt at all, Judy? Which I guess Judy can't talk.
Not at all.
No, Judy can talk. Does it hurt, Judy?
No, it doesn't.
We paid her a lot of money for that comment.
I have a very high tolerance for pain.
So does it feel like a bee sting? What does it feel like?
No, just a little pinch.
A little bit of a pinch. It's really, you know, we use a very fine needle. The needle is the size of a hair. It's a very, very fine needle, and it's just a slight bit of solution that is injected into each area. So most patients say that it's very comfortable, and especially after they see the results the first time, they're very encouraged.
The only thing that's discouraging to a lot of people, I think, that would like to try this now that they're waiting this FDA approval is it's so darn expensive. Do you expect the prices to come down as more companies are introducing similar products?
Botox? Well, you know, it's interesting. Right now, Allergan is the main company that makes Botox. They have worldwide distribution rights. And the cost of Botox over the 10 years has gone up to me in my practice, but with our patients, we've kept the prices the same. The interesting thing is you can get what I call bargain Botox, where it's less expensive, but I think your viewers should be concerned about that, because oftentimes the Botox is diluted. So it's a very dilute solution, and there are more complications with a more dilute solution. Also, it doesn't last as long. It can drift into other muscles and cause complications. As you know, any doctor in the United States can buy Botox, so you want to make certain that you go to a physician that uses Botox often, that knows the muscles of facial expression, that understands facial anatomy, has a lot of experience mixing Botox as well as using Botox.
In New York, Dr. Deborah Jaliman has been offering Botox treatments for more than 10 years. She treats the area between the eyebrows, the forehead, the crow's feet area, and even the lines around the mouth.
So let me have you smile, Joyce, and you can see this is where your lines are forming. So what we want to do is we want to put our Botox everywhere we see the lines forming. And it's not that we're treating the lines, we're actually treating the muscle underlying the skin. I think with the approval of the FDA, it's really a gold stamp to say, you know what, if this is safe enough for the FDA, it's safe enough for me. So many people who may have been cautious about getting Botox in the past, I think they'll feel more confident about getting it in the future. Okay, smile.
And if a doctor injects too much, the patient may end up with an expressionless face.
There are people, by the way, who want to look expressionless, so you have to know who you're dealing with.
We had one clerk saying this cream will make our breasts immediately get perkier. Can a cream do that?
No, plastic surgery can, but not a cream.
And as for the stuff that's supposed to help you lose weight?
Well, I wish there was a slimming gel that you could just eat what you wanted, put it on, and slim down. But unfortunately, there's nothing in this product that could actually slim you down.
Why do you think women are so susceptible? I mean, I gotta say right now, I am. I've spent a fortune at the cosmetics counter buying different potions and creams. Why do we do it?
I think it's hope in a bottle.
We have a certain oil that we make in pregnant women so you don't get stretch marks.
Really? That prevents it?
Madonna uses it.
Turns out Madonna does use the oil. Of course, we don't know whether she has stretch marks or not, but Dr. Jaliman says no product can prevent them.
Stretch marks, for example, are broken elastic tissue in the skin, and some people are genetically prone to it. It isn't even whether you use a moisturizer or you don't use a moisturizer. There's no over-the-counter product that helps stretch marks at all or prevents them.
Here's what we captured on hidden camera from a clerk at the luxury beauty line, La Mer.
I experiment with it. I have for almost 30 years. I mean, I put the cream right in my eye. It's totally pure. The inventor used to eat it. So, I mean,
Well, I certainly wouldn't want to be eating a cream, and I wouldn't put it in my eye as well. The eyes are very sensitive, so you really don't want to put anything in the eye that isn't sterile.
But clerks aren't the only ones making claims. What about those multisyllabic words on the company's own brochures?
La Mer also says they use something called deconstructed waters. Water molecules are declustered or split in two, making them more powerful.
I think water is water.
In December 1995, Renova was granted a license. It had proved scientifically that it could get rid of wrinkles. It's still only available on prescription. So to get Renova, the wrinkle-conscious American woman has to book an appointment with her cosmetic dermatologist.
Dr. DEBRA JALIMAN writes 25 Renova prescriptions every week.
Well, when I look at your skin, there are very fine lines starting under your eyes. And then if you look at your forehead, you do have some deeper lines on your forehead, but you don't have any smile lines, so that's quite good.
I never smile. Never.
It helps to not get smile on.
So what would Renova get rid of? Would it get rid of these lines?
What it does is it softens fine lines. It won't eradicate a very deep line, but what it does is it will lighten up the soft lines that you have, the very fine lines. Because what happens with these products is something like Renova, it stimulates the body's own collagen. It seems to have an effect like that.
That's under the surface of the skin?
Under the surface, and also it exfoliates a lot of the dead skin cells and causes the skin to renew itself a little bit quicker.
We asked dermatologist DEBRA JALIMAN to tell us how to keep our skin looking great during the cold winter months.
It's really important to change your skincare regimen between summer and winter because as the weather changes, the air becomes drier. Cetaphil makes a great cleanser that's not very irritating to the skin. If you like a bar, you could use a product like Dove Unscented soap. You could use baby soap. Or if you want a liquid cleanser, you could use something like Neutrogena. Makes a very mild liquid cleanser. When you're going from summer to winter, even with oily skin, you want to make certain that you're moisturizing your skin. Instead of using a heavy moisturizer like you might use if you had dry skin, you could use a hydrating gel. You could use something that's lighter, but it still moisturizes the skin. Somebody like Lisa, who has very dry skin, she's got a sensitive skin. It tends to be allergic, so you want to use products that are fragrance-free. You could use a product like this product has shea butter in it. In the central face where it's more oily, you could use a hydrating gel, and you could use a facial moisturizer on the edges of the skin. And that will make a big difference because you'll be hydrating both the center of the face and the outer area, but you'll be hydrating it at a different level. When you're looking for products, for example, for the knees, the heels, and for the elbows, since the skin is thicker, you could look for a product that contains lactic acid because the lactic acid penetrates into the skin better. You want to use more of a hydrating formulation. Oftentimes the lip glosses are a lot better for winter. If you use an antioxidant, what that will do is that combats the effects of the free radical damage that we all experience. And what free radicals do is they damage our collagen and our elastic tissue. The significance is that the FDA looked at the studies and they said Botox is safe and effective for cosmetic use in the frown area.
As with most drugs, though, there are certain risks.
You could get eyelid droop, your brows could droop, you could have one brow up and one brow down. People have had problems with drooling when they've had it injected near their mouth.